Hello, everyone, and welcome to another episode of A Conversation with your Board of Advisors of the Long Island Market. My name is Goepfrich Schafer, and I am your Executive Director for the American Cancer Society here, and I'm so glad that we can have another conversation around an important topic. Today, we're going to discuss what it means to be average risk and how to really understand the breast cancer guidelines. As you may know, the American Cancer Society recommends that you receive an annual mammogram at the age of 45 with the option of coming earlier at 40. However, that's for somebody at average risk. What does that mean? So today we have an amazing panel of people with us, our board of advisors, members, Felicia Kasow, Director of Marketing and Operations for Pure Mammography, Maurene O'Conner, Director of Cancer Services Program of Suffolk County at Peconic Bay Medical Center, and Dr. Yelda Nouri for New York Cancer and Blood Specialists. So I'm going to turn it over to Felicia. Felicia, thank you so much for being here today. I'm so glad that we can have a conversation about this.
Thank you. I'm happy to be here. And thank you, Dr. Nouri, for joining us today. So I just had some questions, and I was hoping that you could educate us a little bit more, Dr. Nouri, and regarding your screening and some questions that we're all very unsure of. My first question to you is, what if I have family history, but I'm not feeling anything? Should I be checked? Do I ignore it? Where do I go from there?
Great question. So first and foremost, I always recommend that you have a honest, open, and good discussion with your medical provider. For some, that's their primary care physician. For others, it's their gynecologist. And for a patient who is asymptomatic, but may be at potentially increased risk, such as patients who have family history, there are certain things that as a practitioner, whether it be, again, a medical oncologist, a breast surgeon, your gynecologist, or primary care physician, we can perform certain things called risk calculators. And probably one of the most popular risk calculators I use in my clinical practice, as well as my other colleagues in breast care, is the Gale model. And most of these models incorporate family history as being one of the most important factors for screening an asymptomatic patient. In addition, kind of a little known fact is also patients who have received thoracic radiation, which is a modality that we use in various types of lymphoma. And children and also young adults can receive thoracic radiation as part of their treatment for, let's say, a lymphoma. And if they've received thoracic radiation between the ages of 10 and 30, that puts them at an increased risk of breast cancer. Therefore, we will surveil them typically sooner and more frequently. The other thing I would really encourage patients is to obtain a very detailed family history. Oftentimes, we don't talk about our family history until somebody is actually sick with cancer. But I think it's a great way to open up discussions and really talk openly and honestly about family history.
So, Dr. Nouri, my next question, which is a question we're asked a lot, is if the mammogram detects something, what's the next step?
That's a great question. And, very straightforward. And what typically happens is if you have an abnormality on your mammogram, the recommendations will be based on a physician called a radiologist. And that's a doctor who reads and interprets your mammogram. And typically, a radiologist will recommend follow-up imaging. This includes a diagnostic mammogram, which is a more detailed picture, or a breast ultrasound. If the finding does not look suspicious for cancer, for example, if on further imaging the radiologist feels it's a cyst, No further testing is needed, and they'll have you return to your regular schedule of breast cancer screening with mammograms and clinical breast exams. In some cases, a radiologist may also recommend something called a breast MRI. And this is a modality that we use to help detect and diagnose breast cancer. So, additional imaging may be recommended if you have an abnormal mammography.
After someone has their mammography and they have questions, whether it's good or bad, who do they get that from?
So, for a lot of patients, the radiologist is a wonderful source of support and information. For example, at New York Cancer and Blood, our radiologist will oftentimes meet the patient, develop a relationship, and discuss findings. If the patient requires further information, we always direct them to their provider, typically their ordering provider, such as their gynecologist or oftentimes their primary care provider. So really, you can obtain information from your radiologist, but also your primary care team.
Thank you. And then how long is the process for to have your mammo from start to finish?
Absolutely. So having done one recently myself, a mammogram takes about 30 minutes. I was able to get my mammogram before work and I made it there on time. So typically each of the breasts is compressed for about 20 to 30 seconds. It sounds a little uncomfortable, but it's also extremely important to compress the breast tissue to flatten and spread. So this way the radiologist can have a clear picture. And it's a quick process, and most of us can have it done either before or after work if we're working women. So I always encourage my women to consider getting their screening done regularly.
That's great. And then how would the results be communicated to me?
So typically you receive results in person. Results are also communicated via correspondence, such as a letter that's typically written in layman's terms so that the patient can understand. And then the results are also communicated to your doctor. And then we typically call patients and give them the results of their imaging.
Okay. And then a lot of people are always asking, what is the difference between 2D and 3D?
This is a really, really hot topic in breast imaging. Both 2D and 3D mammograms collect images of the breast, but in different ways. A 2D mammogram, which is considered a conventional digital mammography, we take two pictures of the breast, one from the side and one from above. A 3D mammogram, also known as digital breast tomosynthesis, uses multiple images taken of the breast from different angles, and a computer combines the images to create a 3D picture. Both 2D and 3D mammograms use compression, and whether or not you have the capability of having a 2D or a 3D mammogram, really isn't a huge difference. 3D mammograms may have some advantages. It reduces the number of times a woman can be called back for further testing because of false alarms. And it can also detect very small tumors that may have remained hidden on a 2D mammography. However, the NCCN guidelines states that 2D mammography is still considered reasonable for patients, and if your facility is not capable of providing tomosynthesis, I don't think we're getting inadequate care. It's just what different facilities are able to offer.
That's great. Thank you so much. So everybody's in a rush with everything going on in life. Typically, how long does it take from start to finish to have your mammo?
Typically, like I said, if you're having mammography, it's roughly about 30 minutes. Women can prepare to go in, undress, have their study done. If you're having an ultrasound, for example, if you have dense breasts like I do, that may add an additional 20 to 25 minutes. So I think it really just depends on what exactly your doctor is recommending you have.
And then I'm not sure. A lot of us are not sure of the right answer. Should you have your mammogram every year?
That's an excellent, excellent question. And according to the NCCN, which is the National Comprehensive Cancer Network, which is the governing body that most oncology institutions, we follow certain pathways. For women who are aged 40 and above, we recommend annual screening mammography. It's considered category 1, which is, considered top recommendation. And in addition, we recommend an annual clinical encounter, which means a breast exam by either your primary care provider or typically by a gynecologist. And we also recommend what we call breast awareness, where a woman really becomes familiar with the anatomy and, if you will, geography of their breast, so that they can potentially detect any lesions that do not feel right.
Okay. And then, you always hear where you live, there might be a risk. What is someone's risk of breast cancer?
Wonderful, wonderful question. So, risk factors for breast cancer, number one is going to be family history, potential genetic mutations. Um, in addition, we also look at things like race, ethnicity, prior breast biopsies. We look at the age of first menses. We also look at the age of first childbirth. Interestingly enough, women who do not have pregnancies are considered at higher risk. So, a variety of different things play into our risk factor calculation.
And then, my last question I want to ask you is, I know that we're all a little confused when we're supposed to start. Some people say 35, some people say 40. We're not sure really what is the right age to start to having a mammography.
Great question. So, if you are an average risk woman, meaning you do not have a significant family history, no prior history of thoracic radiation, and your doctor deems you average risk, um, you typically do not begin screening until the age of, now I know American Cancer Society gives the option of 40, but really recommends 45. Um, I do recommend, based on the NCCN, starting breast cancer screening at the age of 40 if you're an average risk woman. If you are at increased risk, the parameters are a little bit different. So, for example, women who have an elevated Gale model. Now, the Gale model is a tool that I typically sit down and do with my patients. This is something a gynecologist may do with you or a breast surgeon. Um, we typically will recommend, if you have a very strong family history of breast cancer, to begin 3 years prior to when the youngest family member was diagnosed. However, we don't recommend screening prior to the age of 30. Um, so whichever comes first, either age 30 or begin at age 40, whichever comes first. But we don't typically recommend screening if you are less than 30 with mammography. Now, of course, there are other cases where patients may harbor a BRCA mutation, in which case they should be following with a breast surgeon, and we typically incorporate the use of things like ultrasound in women who are extremely young or in their 20s.
You really educated us, educated myself, and we appreciate you so much for being on here and helping us out. Thank
My
you so much.
pleasure.
Thank you so much, Dr. Nouri. And I feel like there's such a good common theme here, and it's really know your family history, advocate for yourself, and really talk
Self
to your
awareness.
doctor. Yes,
Yeah.
yes. I think that it's just so important that, there's a lot of things here, and some of it may sound scary, but really, truly, if you have that question, I would recommend to reach out to your general practitioner, your gynecologist, or if you have nowhere to turn, reach out to the American Cancer Society. We can get you the answers that you need. Um, Thank you so much. It really is a pleasure to hear you speak about this.
Absolutely.
Also, I mean, there's this misconception of, this can be put to the side. I don't know where to go. Maybe I don't have insurance or I'm underinsured. And I think that we need to really talk about eliminating those barriers to care. So I'm really thrilled to introduce our Board of Advisor, Maurene O'Conner. Maureen, can you tell us what you do and what you want to tell everyone?
Sure, absolutely. Thank you so much for having me on here. And Dr. Nouri, thank you so much for laying that all out in such a way that it makes it so easy. So
Thank
that's
you.
really, really wonderful. So thank you. And whenever I participate in anything like this, it's kind of like, we're asking people to, go out and get your mammogram. And, there's a lot of ladies out there who have some anxiety about doing that. And if you don't have health insurance or you have inadequate health insurance, meaning that your insurance doesn't cover breast cancer screenings, I just, want to make sure that people know, that shouldn't stop them from getting screened. It shouldn't stop them from taking care of their breast health. There is a program in Suffolk County. They're actually throughout every county in the state. We are the Cancer Services Program of Suffolk County, and we can help you get a mammogram for free near your home. We can also set you up with a primary health care provider and to make sure you get that clinical breast exam that Dr. Nouri was speaking about. And if there's an abnormal screening finding on that mammogram, we have somebody help you make those appointments for you, make sure you get there, do anything we need to do to make sure you get there, relieve your anxiety, whatever it is that's keeping you from doing that will help you do. And so we are here to help you. Do not let the lack of health insurance stop you from doing this. Please, please, please reach out to us. We're here. We're available to you. We average risk women for our program are eligible at age 40. And if you're at increased risk or you have a clinician who you has identified a mass or something that you're having some issues with your breast, well, we can get you enrolled as well. So don't let any of that stop you. Please, please, please. We're here to help you.
Yeah. It's so important that, we take that action and if you're listening to this, I encourage you to share this with your loved ones, share what you have learned. And, if you don't think that you have the proper resources, again, reach out to the American Cancer Society. We have all the ability to reach out to programs like Maureen has mentioned, where we can make sure that you're connected to free mammograms or screening in your areas. And it really truly is important because we know that if breast cancer is caught early, the chances of survival are incredibly more, and that we will stand by you every step of the way. For more information about cancer screening in general, I encourage you to visit cancer.org/getscreened. It is important that we are advocates of our health, and I want to say thank you to all of our guests today who have made this conversation go in a great positive direction. And I can't wait for our next episode.